Welcome back. In this upcoming segment, we have an interview that I did with Dr. Bruce Ward of the BC Dental Association last week. Enjoy. Bruce, we're taking a look at something that I guess all of us north of 49ers have to deal with, things that recede.
Things that recede, yes.
In your case, since you're a dentist, we're looking at the gums.
Right.
Is it something that is going to happen no matter what, or can we kind of stave off the hands of time and make it okay somehow?
No, you really can't avoid it. Sorry, it's one of the truisms of life. You can't avoid gum recession. No.
Maybe slow it down?
You can slow it down to a certain extent, and you can stop certain habits and certain aspects which will create the gums to recede more quickly. But you can't slow it. You can't stop it altogether.
Well, is it like a genetic thing where you're just hooped and you might as well, plan to save a lot of money to just get a whole set of something?
No, I don't think there's much of a genetic component to it. There's going to be a degree of recession no matter what. Secondly, how we brush our teeth is hugely important. Overbrushing is a big cause of gum recession. Poor oral hygiene is a cause of gum recession. The gums get inflamed, they get puffy, they lose the ability to stay attached to the tooth, and so they tend to recede if the hygiene's not really ace. If teeth are crooked, quite often you can't clean the teeth that are in the deepest part of the crookedness, and so they'll recede there as well. That being said, I know a lot of people north of 49 who really have very little recession. So it's not like you're going to get a lot of recession. You might just get a small amount as a function of aging. But if you keep your teeth clean, go see the dentist for regular examinations, you'll mitigate the amount of recession that you get.
Well, does that mean by a certain age, north of 49, I'm going to have to start thinking about, I don't know, surgery to kind of deal with gums that have receded so much?
Once you've got receded gums, once your gums are receded and you look, you can see, and how you know that there's recession is you can see where the enamel from the tooth stops. You can see a little bit of your root.
Yeah.
And so in severe cases, you can see a lot of the root. In non-severe cases, the tooth looks a little longer than it did. It doesn't mean you have to do anything. So some of the problems with gum recession is that when the roots are exposed, because the gums are receded, the roots can be very sensitive to cold and sweet, that kind of thing. There are surgical procedures that can be done to cover up the roots, and they're becoming more and more popular as the techniques become better and better. So there's some surgery performed by some general dentists and also by some gum specialists, periodontists, to actually cover up receded roots. And I've seen some of these done, and they're amazing. But if you don't need to have, your teeth aren't bothering you and you're keeping them clean, you really don't need to do anything unless it's becoming a problem for you.
So I'll just say something really corny to finish up. We just have to grin and bear it.
You just have to grin and bear it, exactly.
Ouch, okay.
Thanks.
Okay, thanks, Bruce.
Thank you.
North of 49, a guide to the rest of your life.